Good afternoon, everyone. Welcome to our Facebook Live. I am Dr. Amjed, ENT consultant at Aster Hospital Sharjah.
Good afternoon. I am Dr. Jolsana Augustine, specialist in pulmonology at Aster Hospital Sharjah. We are extremely thrilled to have you here since we are discussing a very relevant topic today, that is about sleep apnea and snoring.
Sleep apnea and snoring, it's one of the common issue now in our life. We need to share our value insight about this condition and how to treat and how to manage this issue.
So we are happy to address any of the questions which you have on this platform. So we have selected few most important, most frequently asked questions by our patients. So let's get started. So Dr. Amjad, can you just briefly discuss about what is sleep apnea and how is it different from regular snoring?
Sleep apnea and snoring, there are two terms connected to each other. Apnea means cessation of breathing during bedtime, while snoring, it is that loud sound appear during passage of air in the air passages, narrow or lax. So all the patients with sleep apnea, they have snoring, but not all snoring means there is sleep apnea. Doctora, what are the common symptoms of sleep apnea?
In sleep apnea, there is, as already discussed, there is cessation of breathing. So you will have a very disturbed sleep during night. Your sleep quality is totally compromised. So you will experience extreme tiredness during the daytime, excessive daytime sleepiness, mood variations. You will feel that you have decreased concentration during work. These are the common symptoms. And of course, snoring is an external manifestation.
Okay.
Yeah. So how do you feel? How can snoring affect one's overall health and his daily life?
The snoring and sleep apnea affect both the person and his companion, affect the person on his concentration, on his fitness, daily activity, and sleeping time. And in his companion also, it will disturb the sleeping time and feel discomfort during bedtime. Can you explain to me the risk of developing sleep apnea? Who is on risk of developing this condition?
Yeah. So sleep apnea is most commonly encountered in obese and overweight patients. So if you have a body mass index of more than 35, you are at higher risk of developing a sleep apnea. And also if you have central obesity as well as more fat deposition in the neck area, and these all can compromise the airway passage during sleep. And also it has been found that males are more prone to develop sleep apnea. In advanced age is another risk factor. So these are the common risk factors for developing sleep apnea.
Okay.
So what lifestyle changes can you suggest our audience to help them reduce their snoring pattern as well as sleep apnea?
Lifestyle strongly impact and affect this issue. And I advise the patient or the person who's suffering from snoring or sleep apnea to change their lifestyle at the beginning. And this is by stop some habits which affect, like smoking, drinking alcohol, bad time of taking food, arrange their bedtime in a proper way, and start reducing their weight, start to have some sport, but not vigorous sport activity. This will help in this issue and they will feel much more improvement. Doctora, is there any impact of sleep apnea on the cardiovascular health for those patients?
Yes, of course. So sleep apnea is not a single entity. It is a part of a metabolic syndrome. It is a very complex disease. So it can have impact on many organ functions, and cardiovascular system is one of the worst hit in sleep apnea. So as in sleep apnea, the physiology is like you will have disturbed sleep and your oxygen levels will drop during the cessation of breathing. So these fluctuations in oxygen level can actually impact your brain function. And also the heart will have more load to work to compensate these fluctuations in oxygen level. So you will experience irregular heartbeat, elevation in your blood pressure readings, maybe sugar fluctuations, etc. due to the sleep apnea occurrence. So these kind of cardiovascular problems can lead to development of coronary artery disease as well as silent attacks even. So can you just tell us about how children are affected from sleep apnea and snoring, and is there any management measures which can be done to curtail this?
Yes, sure. The children also suffer from this condition, not only the adult. And that because mostly due to the tonsils and adenoid. Because the children suffering from that tonsil disease and they have adenoid hypertrophy, they suffer from narrowing in the airway, and that will lead to snoring and sleep apnea. Also, some children, they have some facial deformities like the size of the jaw, the tongue size, and some syndrome and some medical condition. They will suffer from this issue. If not treated, it will affect on their activity, it will affect on their intellectual and concentration in the study, in the school. So need urgent take consideration and managed properly to improve their life in the future.
Okay.
Doctora, we heard about the CPAP and this machine used in apnea or snoring treatment. Can you speak about it, please?
Yeah. So CPAP means a continuous positive airway pressure device. It is actually a wonder device, I would say, to tackle obstructive sleep apnea. So what it actually does? So it is a pressure device wherein pressurized air is thrown into your airway to keep it open during the natural collapse of the airway, which happens during sleep in sleep apnea patients. So it is a natural way of keeping your airways open during sleep. So that way your sleep apnea scores can come down, your cognitive or your brain functions can improve in long run. So it's actually a wonder device, I would say.
And we need to know some tips for better sleep hygiene to improve our sleep quality and time.
Okay. So as already discussed, sleep hygiene means having a better sleep environment as well as a good quality sleep. To ensure that, we should take some measures. Like we should avoid using devices because the blue light will interfere with the melatonin function, which helps in sleep. So that should be avoided during sleep. And we should have a pleasant environment, not heavy exertion just before sleep. And maybe you should avoid the stimulant drinks like alcohol consumption. And smoking also can clog your airways, so that should be avoided. So these are some of the measures which you can take to address your sleep quality. And one more thing, if you lie on your side, that improves your sleep efficiency actually. So doctor, so how does Aster Hospital Sharjah has got a part in tackling the sleep disorders?
In Aster Hospital Sharjah, we have and we provide all the investigations, all the equipment that help to diagnose these cases and these conditions. And we work as a team between different specialty to manage these cases. So we take it in consideration, and we are helping our patient to solve this issue and to live in a good condition, inshallah.
So I think we have addressed most of the frequently asked questions. Now we will be happy to answer any of the questions our audience have.
Yeah, we have one question from Gree. What are the surgical and non-surgical treatment for sleep apnea? For surgical and non-surgical, I start with the non-surgical. Non-surgical, it will, as we mentioned, we have to change our lifestyle, reduce body weight, have some exercise, treat any nasal condition because of blockage like allergic rhinitis, sinusitis, nasal polyps, medically first. Then if there is no improvement or there is no change in the quality of the snoring, no change in the activity in the daytime, still feeling sleepy at the daytime, we will shift to evaluate the condition if need surgical intervention or not. And this is done by many investigations. We will pass in it, radiological and endoscopic investigation, to check exactly where is the site of obstruction, because this is mostly obstructive sleep apnea. And then we have different modalities of a treatment, of surgical intervention, include surgery on tonsils, surgery on palate, mandible. Also there's some new devices, which is implantable device, will help to repositioning of the tongue site, because this position of the tongue also affect on the snoring condition and the sleep apnea.
Regarding the next question, how effective are CPAP machines and are they comfortable to use? Even though CPAP is the most effective treatment to tackle sleep apnea, it has got its own disadvantages, because actually we are receiving pressurized air into our lungs, and so most of the air can go into our stomach, creating bloating sensation, belching and discomfort for the patient. This can be tackled by using nasal masks instead of using full face masks. There are different types of devices through which we can connect this device to the CPAP. So using a nasal mask, it is a very short mask and it will control this complication. And next thing is, since we are using this amount of air inhalation, you are prone to have the dryness of your mouth. That is very significant, because most patients feel discomfort while using this CPAP for the first time, because they need to physically and emotionally adjust it to this new treatment for them. And also their partners also should adjust with this kind of a treatment, because it has got some noise and it will be connected to their partner the whole night, so that physical and emotional support should be there. And to tackle this dryness of the mouth and all, we can connect this device with a humidifier, wherein we connect with a humidifier device to moisture, to apply, so to give some moisture to the air which we are inhaling. So these are the common disadvantages which a CPAP user will experience.
And I want to add something for the surgical treatment. In surgery also, before using the CPAP, some patients, they don't prefer the surgery and they prefer to go for CPAP. But they have problem, like example, he has chronic sinusitis with nasal polyps that obstruct the nose. At this point, he cannot get benefit from the CPAP actually, or he has some septal deviation, which also interfere with the air passages. So those patients, they should know to use the CPAP, he should take, or he should have a perfect airway to assist the CPAP to work proper. So we advise them, they should meet both specialty to be sure that their condition, what need and how to manage.
So as discussed, sleep apnea is not a single doctor's job. So it is a part of a multidisciplinary evaluation. So we need to find out what is exactly wrong with each patient, because each patient is different. They may be having different problems. So some may be having pure obstructive sleep apnea, some may be having nasal problems which can complicate into a sleep apnea. So these kind of things should be identified by a team of doctors whom they can assess, investigate and then manage the patients accordingly, rather than pushing them into any of the treatment like CPAP or surgery, something like that. Yeah.
I think there is some also audience asking, what should I expect during sleep study at Aster Hospital Sharjah? This study actually, it is not only one session study, but here we provide all the type of the study. Just we need to know which your condition, what's the patient condition. After evaluation, as the Dr. Jolsana mentioned, by different specialty, we will decide which is the proper way to investigate and which is the proper way we need to study this sleep problem or snoring problem. After that, we will give a plan of management which will lead to improvement.
I think Athena has asked a very significant question. Is snoring caused by high blood pressure? High blood pressure alone will not produce a snoring, because snoring is a sound which happens due to obstruction in the airway passages, be it nose or be it in the pharyngeal area. So it is a mechanical thing. It alone doesn't carry much significance if it is not associated with other nasal block, polyps, sinusitis, congestion, or occurrence or concurrent or together with sleep apnea. So it alone will not cause any elevation in the blood pressure. If it has got sleep apnea component to it, then there will be metabolic variations in the body. Like I said, there will be fluctuating blood pressure and heartbeat variations, oxygen level fluctuations, which can have significant impact on different organs. So that is the importance of recognizing sleep apnea. Snoring is just an external manifestation or most common symptom of sleep apnea maybe. Yeah.
There is another person asking, Mr. Raj asked, if surgery is operated for snoring, is it completely safe? Does it affect your lifestyle? The surgery, it's safe, and there is a minimal risk of some issue, but it is not that big issue. The main risk, it's the pain that after surgery, if it's at the level of the throat or tonsils, and this is especially for the older age, not for the kids. Otherwise, it is safe, and it will not affect the lifestyle. In the opposite, it will make your lifestyle much more better. You will feel much more active. You can perform your daily activity proper than before, and you will protect your body from any complication in the future. So it is for your general condition, it will be much more better.
So Mohammed has asked about, does obesity cause sleep apnea? As I said, obesity is a major risk factor for having or developing sleep apnea. But there are persons who are obese who doesn't have sleep apnea, and also also a thin person can develop sleep apnea. So more than 70% of patients with sleep apnea are obese. That would be the correct way of expressing it. So Asad has asked another question, how body weight is linked with snoring. So in persons with high body weight or body mass index, there will be fat deposition throughout the upper airway muscles and the soft tissue area as such. And they will have that central obesity which can compromise the breathing pattern during sleep. So these kind of a fat deposition in the upper airways, this will press on your airway and compromise the airway diameter actually. And that can compromise the air flow passage through the airways during sleep. So that is the main link between body weight and snoring. And when air passes through a narrow tube or pipe, you can know that it will produce a sound, and that is called snoring.
Okay, another question from Mr. Asad. Do nasal spray work for snoring? As we said, snoring can appear if there is nasal problem, like congestion, rhinitis, allergic rhinitis, nasal polyps. So, as medical treatment for this condition, nasal spray, it's a cornerstone, because nasal spray will reduce the nasal congestion, but it should be used under control and under advice of ENT doctor. Not like anyone can buy any nasal spray and use it, because this will sometimes aggravate the condition. So yes, it's give benefit, and it's part of the treatment. Another question, is snoring is genetic? No, snoring, it is not to be genetic unless it's connected to some disease which is genetic. Like example, as we said, craniofacial abnormalities. The craniofacial abnormalities is genetic, and it's lead to snoring or sleep apnea. But sleep apnea as entity, it has family relation, not genetic predisposing factor.
So sleep apnea, as we discussed, it is not a simple disease, and it can have impact on cardiovascular system, our blood pressure, and the most important risk factor for unidentified sleep apnea is that you can have road traffic accidents if you are sleepy during driving. So there is one scoring called Epworth Sleepiness Score, wherein you score the severity of sleep apnea. So in that, the main criteria is, do you feel sleepy while being in a traffic light? So that itself shows the significance of having unidentified sleep apnea. You can have problems for yourself as well as for others. So unidentified sleep apnea is just like a tip of an iceberg. So that is why we are in this platform. We are trying to create more awareness about sleep apnea and associated complications. So one should identify the complications correctly and tackle it, so that you will have a good quality life ahead. Is there any more questions?
Yes, there is another question. What about anti-snoring devices? Do they work? Those devices mostly it is nasal appliance that keep nasal open. It will affect if there is some condition, we call it nasal collapse or nasal valve collapse. Otherwise, it will not have any effect. The other devices, it's used by dental. It is to correct the teeth and the jaw, upper and lower jaw. Also, this appliance has limited uses according to the condition. It will not be suitable for each patient or for each case.
There is another relevant question by Mr. Jensen. Is there any recommended sleeping position to avoid snoring? Yes. So most of the sleep specialists advocate sleeping on your side so that the fat deposition, the central fat and the fat deposition in your throat and all will not interfere with the airway. So lying on one side is very effective in tackling snoring, as well as to some extent you can decrease the sleep apnea scores when you lie on your side.
Another question, what diagnostic tests are used to evaluate snoring and sleep apnea? The evaluation of snoring, there is limit test to evaluate. As we said, snoring, it is a sound, you can hear it. But sleep apnea, yes. The test of evaluation, we call it sleep study or polysomnography. And in this test, we connect the patient to a machine that evaluates all his vital signs, oxygen level, heart rate, respiratory rate, even brain activity. And this device also measuring for a while the snoring. But it is not the main idea to measure the snoring, it is to measure the apnea attack. Because the apnea, it is the risky factor in this issue. And we will measure how much it will come at night. We have some parameters. According to that parameters, we will put the plan and we will give the advice for the patient. So as we said before, it is multidisciplinary team action. It's not taken by a single man. It should be evaluated from different specialty to give the best plan and treatment.
So there is another question, can phlegm cause you to snore? Yes. Anything which can interfere with your airway patency can cause snoring. So the phlegm deposition or the mucus, as you commonly call, can block the airways and produce snoring sound.
Breeza asking, does sleep apnea go away completely after treatment? For completely disappearing, because we cannot say like this, because there is some apnea which is normal limit. All of that we are talking, there is limit of apnea according to the parameters. It could be normal, but we are eliminate the risky apnea. Yes, it will be treated. That will affect your body. That will affect your activity. Yes, it will be eliminated and improved your condition. About that question, yes, but not all apnea.
I would like to add a point.
Yes.
So, sleep apnea is also like having hypertension or heart disease or something like that. It is a controllable disease. It is not a fully curable disease, because if you have that predisposition, by lifestyle changes and all, you can modify the disease. So, that is the main thing about this sleep apnea thing. So you can control with appropriate lifestyle modifications and avoiding caffeinated drinks that interfere with sleep, and avoiding stimulants like alcohol or smoking and something like that.
We have another note about, does snoring mean bad sleep? No, we mentioned that at the beginning. Snoring, it's a sound appear due to narrowing in the air passages. Sometimes it's associated, sometimes not associated with the apnea. The risk, it's the apnea. If there is apnea, surely there is a snoring. So the apnea, it's indicate bad sleep, not the snoring. Snoring, it's factor or it's point added to the bad sleep, but the apnea, it's the risky factor.
So Mariam has asked a question, when should I see a doctor about snoring? So actually, snoring is just a sound that, as we discussed, but if your partner notices that you are having that stoppage of breathing during the sleep episodes, then that is a dangerous thing. It is called witnessed apneas. So if your partner says that you are having these kind of an episodes and you are having awakenings in between and a snort or choking like sound in between your sleep, then that is dangerous. That could be an indication that you may be having sleep apnea. So in that case, you need to consult a doctor and get it clarified.
Just want explanation about like nose clips or chin online buying. Actually, online buying for those devices, I'm not advise, because these devices are not issued by medical company mostly, or even it will not be suitable for your condition. First, before buying any device, you have to know what's your condition, what's suitable for you. Then go and buy it, no problem with it.
What conditions make snoring worse? That we have already discussed, like having nasal congestion, and maybe some people are allergic, like they have sneezing episodes, allergic rhinitis. So in that case, you should consult an ENT doctor and get it treated, because that can worsen the snoring sound and snoring pattern.
Jerry asked a question, what should you not do if you have sleep apnea? If you have sleep apnea, you should never neglect. This is the first thing. You have to visit the hospital, the doctors, to evaluate your condition, to check your general condition first, and nasal airway and oral airway, and the pulmonologist should check your state, and maybe we will order for you the sleep study test to evaluate your state and condition. And also you have to change your lifestyle, as we mentioned. Stop alcohol, stop smoking, reduce consumption of coffee or caffeine, reduce your body weight, start to some activity, athletes activity, which is not vigorous. And this way you will start to help your body to resist that apnea and improve your condition.
So Deepthi has asked, what can happen if sleep apnea goes untreated? Untreated sleep apnea can obviously cause many problems, like road traffic accidents, as I have already discussed. Also, you can have silent stroke and silent cardiac attacks, like heart attacks. And these are the major complications which can happen with untreated sleep apnea. So it's a dangerous thing. If you have significant sleep apnea and all, you may develop these complications. So that is why we should get it sorted out before it gets worse. And in the sleep study, we are looking into the score of the sleep study, score of the sleep apnea. And if you are having more than 30 score, that means you are in the severe sleep apnea score. So with the appropriate use of CPAP, you are tackling the severity score to come down to less than 5 actually.
Mr. Dipti asked about what can happen if sleep apnea goes untreated. Surely this is danger and it is not good for you, because untreated sleep apnea, you just develop another complication in your body, another problem in your systems, I mean the cardiovascular system, respiratory system, endocrine system, and you will reach a point untreatable, which means even if you will go to do any surgery or take any medicine or use any device, this beyond the limit of improvement. So when you have this problem, better to manage as soon as possible.
And another thing with untreated sleep apnea is that you can have mood variations, psychological problems, depression and severe anxiety are also seen with untreated sleep apnea. That is one thing to be worried about actually. And Akshi has asked about major warning sign of sleep apnea. Yeah, as discussed, witnessed apneas, meaning your partner or your anybody in your room, your roommate will notice that you are having that stoppage episodes during your sleep, and you have a fragmented quality of sleep pattern wherein you will be experiencing total stoppage of breathing, and then a rapid awakening or sound which can be called like a snorting sound. So these are all characteristic features or warning signs that you may be having sleep apnea.
What about CPAP? They are asking if there is any side
effects.
We cannot say the side effect of device, but what complication associated with the using of CPAP. The CPAP, not always the patient can adapt using of it. maybe need 2 to 3 months to adapt on the using this machine. And also it's associated with some complication like dryness of the mouth, dryness of the nose, but there is solution for each issue. And I think you have more experience in that, Dr. Jolsana, to speak about it.
So CPAP, when you start using CPAP, don't expect to have significant improvement in say 1 or 2 days. It's a long treatment, so say around 1 month time you should give for that machine to act, because it's a long disease, it's a long problem, and it will take time to adjust with a new machine. And this device will do wonders if you are compliant to the treatment. And at least you should use CPAP for more than for at least 4 hours during a night's sleep. And around more than 70% of the nights you should use it. You should use it. So that kind of a compliance should be ensured by patients when they are using CPAP. Otherwise, it won't work.
And I want to add something. Now it's very good. They create that machine which is portable.
Yes.
I remember CPAP at the beginning, it was very big, very heavy, cannot move it, you cannot take it. Now you can take it with you everywhere, where any place you will go and sleep, you can take it and use it. And this is benefit.
Yeah, now we have a lot of fancy instruments. So actually we should consult a doctor before buying it online, because a lot of features may be available in the fancy things which you may not need. And some patients with extra diseases or extra complicated things and all may need sophisticated devices. So it's better to consult a doctor before buying a CPAP machine.
Okay, Doctora. Thank you all for joining us today, and we hope you found that our valuable information will help you. And inshallah, we support your knowledge about that subject.
So our takeaway message is that if anybody of you or your loved one has got any sleep apnea related diseases or disorders which you identify, please feel free to visit Aster Hospital Sharjah. We are happy to help you here. We will sort your problems out.
Also, you can download the application, My Aster application, to book appointments and for a wide range of health services at your convenience. Stay healthy and take care.